What you need to know from the Center for Disease Control and Prevention, Hepatitis B Vaccines. Hepatitis B vaccines can prevent hepatitis B. Hepatitis B is a liver disease that can cause mild illness lasting a few weeks, or it can lead to a serious lifelong illness. Acute hepatitis B infection is a short-term illness that can lead to fever, fatigue, loss of appetite, nausea, vomiting, jaundice, and pain in the muscles, joints, or stomach. Chronic hepatitis B infection is a long-term illness that occurs when the hepatitis B virus remains in a person's body. Most people who go on to develop chronic hepatitis B do not have symptoms, but it is still very serious and can lead to liver damage, liver cancer, and death. Chronically infected people can spread hepatitis B virus to others, even if they do not feel sick or look sick themselves. Why get vaccinated? Hepatitis B is spread when blood, semen, or other body fluid infected with the hepatitis B virus enters the body of a person who is not infected. People can become infected through birth. If a mother has hepatitis B, her baby can become infected, or by sharing items such as razors or toothbrushes with an infected person. A person can become infected with hepatitis B if they have contact with the blood or open sores of an infected person, or has sex with an infected partner, or by sharing needles, syringes, or other drug injection equipment. A person can also get sick because of exposure to blood from needle sticks or other sharp instruments. Most people who are vaccinated with hepatitis B vaccine are immune for life. The hepatitis B vaccine is usually given as 2, 3, or 4 shots. Infants should get their first dose of hepatitis B vaccine at birth and will usually complete the series at 6 months of age. Sometimes it will take longer than 6 months to complete. Children and adolescents younger than 19 years of age who have not yet gotten the vaccine should also be vaccinated. Hepatitis B vaccine is also recommended for certain unvaccinated adults. People who have sex partners that have hepatitis B, sexually active persons who are not in long-term monogamous relationships, persons seeking evaluation or treatment for a sexually transmitted disease, men who have sexual contact with other men, people who share needles, syringes, or other drug injection equipment, people who have household contact with someone infected with the hepatitis B virus, and healthcare and public safety workers at risk for exposure to blood or body fluids. The hepatitis B vaccine is also recommended for these unvaccinated adults: residents and staff of facilities for the developmentally disabled, persons in correctional facilities, victims of sexual assault or abuse, travelers to regions with increased rates of hepatitis B, people with chronic liver disease, kidney disease, HIV infection, infection with hepatitis C or diabetes, and anyone who wants to be protected from hepatitis B. The hepatitis B vaccine may be given at the same time as other vaccines. Talk with your healthcare provider. Tell your vaccine provider if the person getting the vaccine has an allergic reaction after a previous dose of the hepatitis B vaccine or has had any severe life-threatening allergies. In some cases, your healthcare provider may decide to postpone the hepatitis B vaccination for a future visit. People with minor illnesses, such as a cold, may be vaccinated. People who are moderately or severely ill should usually wait until they recover before getting the hepatitis B vaccine. Your healthcare provider can give you more information. Risks of a vaccine reaction. Soreness where the shot is given or fever can happen after the hepatitis B vaccine. People sometimes faint after medical procedures, including vaccinations. Tell your provider if you feel dizzy or have vision changes or ringing in the ears. As with any medicine, there is a very remote chance of the vaccine causing a severe allergic reaction, other serious injury, or death. What if there is a serious problem? An allergic reaction could occur after the vaccinated person leaves the clinic. If you see signs of a severe allergic reaction, such as hives, swelling of the face and throat, difficulty breathing, fast heartbeat, dizziness or weakness, call 911 and get the person to the nearest hospital. For other signs that concern you, call your healthcare provider. Adverse reactions should be reported to the Vaccine Adverse Event Reporting System. Your healthcare provider will usually file this report, or you can do it yourself by visiting the VAERS website at www.vaers.hhs.gov or call 1-800-822-7967. The VAERS hotline is only for reporting reactions, and the staff does not give medical advice. The National Vaccine Injury Compensation Program is a federal program that was created to compensate people who may have been injured by certain vaccines. Visit the VICP website at www.hrsa.gov/vaccine compensation or call 1-800-338-2382 to learn more about the program and about filing a claim. There is a time limit to file a claim for compensation. How can I learn more? Ask your healthcare provider, call your local or state health department, contact the Centers for Disease Control and Prevention at 1-800-232-4636 or visit the CDC's website at www.cdc.gov/vaccines. Many vaccine information statements are available in Spanish and other languages. See www.immunize.org/VIS.